Here, let me talk about the psychiatric nursing. There are 4 phases of nurse-client relationship. Some of the books said there are 3 phases. The 4 phases they call pre-interaction phase, then orientation phase, working phase, and termination phase. The book that said 3 phases, they have orientation phase, working phase, and termination phase. So what actually we do during the pre-interaction phase? In this phase, we decide what are the professional goals, what are the target of the treatment. It depends on the diagnosis of the patient aging, level of the disease, and also the physical status. The orientation phase, it is important to make the purpose, nature, time, and we try to trustable relationship with the patient. During orientation, we also assessment of the client and we try to establish a trustable, comfortable relationship with our client. During the working phase, this is the active problem-solving phase. During this phase, we try to planning and intervention. Also, try to establish the goals. Also, problem-solving phase. We explore our thoughts and feelings, formulate the nursing diagnosis. The next one is called termination phase. Achieve the goal, and also time will come to say goodbye. Your patient get inside the hospital because of sickness. Nobody want to come in hospital, and nobody want to stay in hospital for a long time. Time will come to discharge and make the room for the new patient. During the termination, and NCLEX board sometimes asks a question, when termination phase starts, it begins at the admission. Because when patient admission, the last target, they have to leave the hospital, means termination. During the termination, with evaluation of the goal, allow the client to discuss the feelings about the termination and loss, if any. Also, maintain the limit of final termination. Very important. Next, here, I am going to talk about a little bit about the treatment modalities, or what are the different type of therapy we use during the patient care. First one is Milieu therapy. Also, we give them management behavioral disorder. Also, last one is a somatic therapy, like electroconvulsion therapy, most popular or most common we use. Let me talk about a little bit Milieu therapy. So, what is Milieu therapy? It is a psychotherapy in which the patient's social environment is controlled or manipulated with a view to the preventing the self-destructive behavior. And Milieu therapy is manipulated, I said, and also control of the patient's environment to prevent the self-destructive behavior and improve the coping skill. During the Milieu therapy, we try to promotion of interaction and communication skill in a controlled setting. So the Milieu therapy refer particularly, let me read what we wrote here. Milieu therapy refer to the physical and social environment in which the individual is receiving the treatment. Milieu therapy sometimes one-to-one we call individual. Milieu therapy sometimes in a group, sometimes including the family, also sometimes including to change patient behavior. So the safety is the most important priorities in managing the Milieu therapy. And also all encounter with the client have the goal of being the therapeutics. Next here, they said all members of a treatment team contribute to the planning and functioning of the Milieu and are significant and vulnerable to the client's successful treatment outcome. And the team generally include a registered nurse, social worker, exercise therapist, recreational therapist, psychologist, psychiatrist, who is a doctor, occupational therapist, clinical nurse specialist, and also nurse practitioner. Shortly called, all are healthcare provider. The community meetings, active groups, social skill groups, and physical exercise program are included to accomplish the treatment goal. So Milieu therapy one-to-one relationship are used to examine the client behaviors, feelings, and interaction within the content of therapeutic group activities. As I told you, Milieu therapy is sometimes one-to-one, we call individual, sometimes in a group. So individual interact together to the problem solving. Sometimes family involved. So focus is on family, not individual. And we said behaviors. So reconditional of learning behavior. So they say the focus of Milieu therapy is to empower the client towards involvement in a setting his or her own goals and to develop the purposeful relationship with the staff to assist in the meeting these goals. And sometimes we go for the managing behavioral disorder, interpersonal psychotherapy, the treatment modalities that used to therapeutic relationship to modify the client feelings, attitude, and behavior and work within an agreed upon the time frame to help meet the client goals. So this is the target, right? To better outcome. The therapeutic communication forms the foundation of the therapist and client relationship. So every healthcare provider must know what are the effective way of communication and what are the blocks of communication. And this relationship is used as a way from the client to examine other relationship in his or her life, right? And also we do the therapy, supportive level of psychotherapy. So brief therapy or may extend over a period of years, allowing the client to express the feelings, explore alternatives, and make the decision in a safe and caring environment. No plan exists to introduce a new method of coping, supportive level. Next here, interpersonal psychotherapy. It may be re-educative level or reconstructive level of psychotherapy. So managing behavioral disorder. The re-educative level means the client explore alternatives in a plan and systemic way, and this require a longer period of therapy than the supportive therapy. The client agree upon and specify the desired change of behavior and learning the new way or of perceiving and behaving. And the techniques may include the short-term psychotherapy or reality therapy, cognitive restructuring, or behavior modifications, or development of coping skill. So managing behavioral disorder particularly incorporate behavior management technique, right? So reconstructive level, so emotional and cognitive restructuring or positive outcome include a greater understanding of and self and others, or more emotional freedom and the development of potential abilities. Behavioral therapy, the treatment approach that use the principle or behavioral therapy to bring about the behavioral change, right? So I said during the behavioral therapy, we try to escalation techniques, right? So now go more about the behavioral therapy, desensitization, aversion therapy, and modeling therapies. So first of all, I want to tell here the first attempt to reduce the level of aerosol. It is the first target. Also, the nurse must appear the claim when start the behavioral therapy, or self-assume is important because anxiety can make the client feel anxious or unsafe, which can make the patient aggressive or aggression. Always during the behavioral therapy, use a claim low monotonous tone of voice, very important, and move the situation outside or to the other room. Also explain the limit and role in an authoritative manner, very important for behavioral therapy. The last one here, we tried for cognitive therapy. Cognitive therapy and active directives and time-limited structural approach used to treat a variety of disorder, including anxiety and depressive disorder. And cognitive therapy is based on principle that how individuals feel and behave is determined by how they think about the world and their place in it. Their cognitions are based on attitude, right? Also, assumptions developed from previous experience. The therapeutic techniques are designed or to identify or reality test or correct the distorted conceptualizations and dysfunctional belief underlying these cognitions. So again, I said therapeutic communication is super important to deal with the psychiatry patient. And what is the therapeutic techniques? Sometimes it depends on patient condition. But every healthcare provider must know what are the effective way to communicate with the patient and what are the blocks of therapeutic or non-therapeutic communication, what we should avoid, right? I want to give few examples before to finish. Like you ask a question to the patient, but you do not hearing. You do not give the concentration. You hears, but not active listener. This is the blocking or non-therapeutic communication. Rejection, ignore, or reinforce only the part of the message and ignore rest of others. Also, you do not understand your patient. You do not encouraging them or promote anger or give too much advice or focus the client to discuss the issue that are threatening or changing the chapter again and again or ignores the theme or during the discussion you laughing or asking question that is not relevant. All of this non-therapeutic communication, what we should avoid.